intraoperative radiotherapy right now.
One of treatment jika anda mahukan radioterapi infrabedah IORT, pesakit hanya perlu menjalani kemoterapi sekali sahaja.
Audio Jungle.
Breast therapy choices are often between removing the breast or preserving the breast. By removing only the cancer tissue and hoping with several weeks of radiation therapy will prevent it from turning. But a new technique that is used for safely delivering the dose that is done in weeks of radiation therapy now can be done in a span of a few minutes. Joining us today, Dr. Penubra from Universiti of Malaya. Good morning, doctor. Good morning. Thank you for having me. We were talking about this treatment that is only available in few hospitals, and it is a new hope for breast cancer patient. Explain it to us. Describe it to us. IORT, is it? What does that mean? IORT, or known as Intraoperative Radiation Therapy, is a new type of therapy where high dose of radiation dose is given during lumpectomy surgery. So it's right after the cancer treatment that is removed during the lumpectomy surgery. The idea here is that as we talk about advancement in breast cancer, one of the things we focus on other than improving the quality life of the patient, we also trying to improve the quality of the treatment. IORT takes a shorter time than traditionally delivered therapy, as IORT only takes single dose. Single dose in a few minutes, and that's it? Yes, just a single dose. After the surgery is done, you open your eyes, you're done. That's really fast. Only a single dose and it's done in a few minutes. That's a fast procedure. How is it done? What are the steps? Can you explain it to us? The steps are really simple. There are only 4 steps. So there are only 4 steps for procedure of IORT. The first step is the pre-radiation treatment, where the interbeam IORT is delivered during the lumpectomy procedure immediately after the removal of tumor. The second step is the positioning of applicator. After the surgeon has removed the tumor, the radiation oncologist positions the interbeam applicator in the area of the breast. The third step is the low energy radiation, but with high dose is delivered locally to the targeted tissue in the tumor bed, minimizing health tissue exposure radiation. And lastly, the fourth step is the removal of applicator and closed incision. After 20 to 30 minutes, the applicator was removed and the surgeon then closed the incision. I feel like this new treatment, there's always pros and cons in everything. So what are the advantages compared to the traditional treatment? So there are a lot of advantages of IORT compared to traditional therapy, such as minimal exposure of surrounding tissue and in all reducing normal tissue toxicities, especially for the organ at risk OAR. It also reduces the chance of residual tumor at the site of the surgery, thus maximizing local control of tumors and reducing probability of local recurrence. Not only that, it also maximizes the radiobiological effect of a single high dose of radiation. And of course, it's faster treatment time. From 6 weeks, it reduced to a few minutes, from 20 to 30 minutes, really fast. Not to mention traditional therapy. It's a radiation that is given from out to in, which it can give toxicity for other tissues surrounding the breast. But IORT, it is a treatment that is given inside the breast, so the tissue outside the breast, the skin, is not affected at all. the toxicity of the other tissues, cell tissues that is not involved in IORT, are safe. So this is one of the advantages of IORT. I see. That's really good. That's really helpful. Even though there are a lot of advantages, what are the disadvantages that the patients needs to know prior to getting the treatment? Of course, everything does not only comes with positive side, there's also negative side. So the disadvantages of IORT is, as IORT is given in single session, it may be more difficult to correct the misadministration. Also, it requires dedicated equipment. IORT has a device that is really expensive. Like I said earlier, it is not available in all hospitals. In Malaysia, there are like 2 to 3 hospitals that have these devices, but yes, it is not widely known. This device is expensive because IORT, it uses an intrabeam where the X-rays are emitted in a spherical radiation pattern, where an applicator is placed over the beam to allocate the position and size of the treatment. Of course, like any treatment in this world, there are no 100% guarantee that you are cured. Thank you, doctor. It will be a sin for me not to ask this question, but I have heard that IORT have a specific selected group of women that are chosen to undergo this treatment. Could you enlighten us who are these special persons? So you may benefit most from IORT if you are over the age of 50 and have an early stage breast cancer that has not spread, and usually for postmenopausal women. As also quality assurance or quality control in IORT, which is performing basic quality assurance in handling with IORT equipment, and then pre-treatment quality assurance, which is dealing with equipment preparation and verification prior to the IORT treatment. Lastly is treatment quality assurance, where it is done during the IORT procedure. Yes, medical physicists are involved in IORT. Their main job is to make treatment planning with the safest and ideal radiation volume, and also ensure less tissue exposed to radiation. Not only that, but also do pre-testing with phantom for 3 to 5 days to ensure organ at risk such as heart and lung are safe for the treatment. So here are some of the examples of the treatment planning that medical physicists will do.